Hello friends, I am Dr. Jayanti Kamath, IVF consultant, obstetrician and gynecologist practicing at Srishti Fertility Care Center and Women's Clinic, Mumbai. So today I will be talking about hysterolaparoscopy. So hysterolaparoscopy is considered as the gold standard in the evaluation of infertility. So what exactly is this hysterolaparoscopy? So it consists of two parts, that is hysteroscopy and laparoscopy. So hysteroscopy is we introduce a telescopic instrument through the cervix or the mouth of the uterus to visualize the inside of the uterus. Now why is it so important? Many of my patients have asked me, why is hysterolaparoscopy? Should we really do it? It's a major surgical procedure. Is it really necessary? So before we understand this, let us just revise our knowledge of how conception occurs. As you all know, every month an egg is released from the ovary and this egg travels through the fallopian tube. Around the same time, if intercourse takes place, the sperms travel inside the uterus, meet the egg inside the tube and form an embryo, and finally the embryo gets implanted inside the uterus. Suppose there is any problem with the ovary, with the ovulation or with the transport in the tube or in the uterus, so this process of conception will not occur. So hysterolaparoscopy precisely evaluates the reproductive system of the female. Hysteroscopy, what we do is we introduce a telescopic instrument through the cervix or the mouth of the uterus. As the instrument is introduced inside the uterus, we also study the cervix as well, because in some women the cervix is very tight or stenosed and even the sperms cannot pass through it. So in such a situation, we dilate the cervix and then we go inside the uterus slowly, and the first thing which we see inside the uterus is the openings of the tubes. Now the opening of the tubes have to be free of adhesions. So if there are any adhesions, we can clear it around at the same time. What else do we see inside of the uterus? We notice whether there is enough space, because ultimately the baby is going to grow inside the uterus. So we just observe whether there is enough space for the baby to grow. We observe the lining of the uterus and whether the cavity is normal, whether there is a submucous fibroid which is popping in, or whether there is a septum, or whether there is a polyp. Now certain things cannot be visualized by ultrasonography. So whenever we do hysteroscopy, we get a lot of surprises. And the beauty of this investigation is you can not only diagnose, but you can also treat the condition at the same time. Now this is often accompanied by another procedure called as laparoscopy. So what do we do in laparoscopy is we introduce a telescopic instrument through the umbilicus, through the abdomen, to see the outside of the uterus. So what do we see from the outside of the uterus? We see the ovary, the tubes, the uterus and the other structures which are surrounding the uterus. So what problems can occur over here? There can be a cyst in the ovary, or the ovaries may be very much enlarged in a case like PCOS. So they may require drilling, or the tubes there may be some adhesions which are blocking the tubes, or the tubes are getting kinked at some time. So we free the tubes from the adhesions. Then we observe the uterus. So whether the uterus has any tumours called fibroids, whether it has a subserous fibroid. So all these things we observe whether the shape of the uterus is normal, because some women are born with an abnormal uterine shape. So most of the times even this can be treated with laparoscopy. Then we do a procedure called as laparoscopic chromotubation. So what exactly is this procedure? We introduce a dye in the cervix and through the mouth of the uterus, and we observe whether the dye is coming out from both the tubes. Suppose the dye is coming out freely, that means the tubes are open, they are patent and they can allow the passage of the oocyte and the embryo. Suppose there is a block, so these blocks can also be treated by hysteroscopy, by a procedure called as hysteroscopic tubal cannulation. So all these things can be observed in by doing a laparoscopy. We can also see other diseases, associated diseases like as I already mentioned, fibroids. They can be both diagnosed as well as we can remove fibroids also. Then there are conditions called as endometriosis. Endometriosis can be diagnosed only and only by laparoscopy. Sonography will not diagnose endometriosis unless the patient has a huge ovarian endometriotic cyst. So this condition can be suspected, but the ultimate diagnosis will only be by laparoscopy. In our country, there is another disease called as genital tuberculosis. So most people think that tuberculosis is only limited to the lungs, and which is known as pulmonary tuberculosis. So in the case of pulmonary tuberculosis or tuberculosis of the lung, what happens is the patient has a lot of symptoms. He feels breathless, he keeps coughing, there is loss of weight, he has an evening rise of temperature or slight fever all the time. So this condition can be very well diagnosed by a simple chest X-ray. So tuberculosis can occur in other organs as well, especially in a condition called as genital or pelvic tuberculosis. So this condition cannot be diagnosed by sonography. At the most, it can be suspected by the clinician, but the ultimate diagnosis is actually by laparoscopy. When we see by laparoscopy, we can see the tuberculotic lesions. We can also take a biopsy to confirm our diagnosis, and in case the person has tuberculosis, that person will have to be treated for a total period of 9 to 12 months. So this is how laparoscopy helps us in diagnosing various conditions. Now there are other conditions apart from infertility where laparoscopy can be used, like tubal patency I have already mentioned. Then conditions like endometriosis or pelvic adhesions when the patient has undergone previous surgery, or there is tuberculosis, endometriosis, so everything is all stuck together, so we can free all these structures. Then acute pelvic lesions such as ectopic pregnancy, very important, because ectopic pregnancy is something that usually a pregnancy is inside the uterus. Ectopic means something where the pregnancy grows at an abnormal site. And what is the abnormal site? Anything other than the uterus will be an abnormal site. Suppose the ectopic pregnancy is in the tube, we can diagnose it. At the same time, we can remove the ectopic pregnancy also, and in fact save the life of the patient. Then acute appendicitis can be made out, acute self-inchitis or inflammation of the fallopian tubes, that also can be diagnosed. Then certain tumours can be taken out by laparoscopy. Laparoscopy can helps us to even take out the cancerous growths from the uterus. In short, as of today, almost all surgeries which can be done by the open method can be done by hysterolaparoscopy. The advantage here, as I have already told you, we can diagnose and treat the condition at the same time. It requires a very short hospital stay, and patient needs to stay in the patient need not take prolonged bed rest or anything. He can get back to work very quickly. So friends, any questions about hysterolaparoscopy or laparoscopy, gynec laparoscopy, you can always contact me at lybrate.com. Thank you.